Backbenchers, are you hearing me or not? Okay? Good. I am feeling very much. I just take off my woolen suit. Because of that, I am telling her him to increase the AC. All right. Now today we will talk about the endocrine system. Endocrine system is that part of gate bunker. As till date you have covered the maximum part of tissue of the body, starting from epithelial to connective tissue, muscular tissue, nervous tissue, and all that. Now only the two classes left of general. After the first today's class, then left only two. So endocrine system, this system includes the glands of bodies, and these glands, they are secreting the hormones or chemical messengers, both hormones as well as chemical messengers. The function of these hormones, they act over the target cell of the body. Target cell means the cell on which these hormones will act. That is called target cells or target organs. The function of these hormones are very important. They control and affect the body development and also the growth. Not only the body development and growth, but also controlling the sexual parts, reproduction parts, and also the normal behavior of the person. All these things are controlled by the hormones. So by seeing this, we can say that it is very important system of the body. Slightly differs, any part of the hormones can affect the features of the person or the capability or doing performance of the persons are very much affected. So being a doctor, it is very important for all point of view. So read it clearly. First of all, I am talking of the general pattern of the hormones. The different hormones, the glands which we will talk, what are the different endocrine glands? All these endocrine glands, they regulated or controlled by the hypothalamus. So hypothalamus is the main part which control and regulate the function of any endocrine glands. Next to the hypothalamus, another important part of the endocrine system is pituitary glands. The pituitary gland, as I am showing you the diagram, it is located in the brain. When you will read the head and neck part, the cranial cavity or the skull in which the brain is lying, that is called cranial cavity. Lying in the cranial cavity, there is a fossa, depression in the sphenoid bone. Lying in the sphenoid bone, there is present the pituitary gland. And in the part of the brain, there is present the hypothalamus. The hypothalamus and pituitary gland are connecting with each other throughout the life. One thing. See this part. Lying here, that is the part of the hypothalamus. And as we come down, look here, this is the pituitary gland. So hypothalamus and pituitary gland are connected with each other. I will talk the different parts of the pituitary gland, then you will understand that which part is connecting with the hypothalamus. All right. Now come into the neck. Everyone is knowing this is the thyroid gland. So thyroid gland is the another endocrine gland. Just posterior to the thyroid gland, you can see here the intricate line diagram. These are the parathyroid glands. So parathyroid glands, they are present in the superior group and inferior group, 4 parathyroid glands, and they are present on the posterior part of the thyroid gland. That is also the part of endocrine gland. Now come to the part of here. These are the kidneys. Both superior pole of the kidney, there are present the small part of the gland. These are called adrenal gland or suprarenal gland. Adrenal gland or the suprarenal gland. This is the another part of endocrine gland. Then look here. This is the pancreas. The pancreas is also the part of endocrine gland. Then come to the part of uterus in female and testes in the male. They are having the part of male and female reproductive organs. In the uterus, there is the part of production of the ovaries and eggs, and in the male reproductive system, they are producing the testosterone and sperms. So, all these are the different part of the endocrine glands. Besides this, we will talk of the another gland, pineal gland, that is also present in the part of brain. And besides that, the another is placenta. So all these come under the head of adrenal glands. Now before talking of these, let's see the hypothalamus. Hypothalamus is located in the base of the brain, and this is the main organ which controls or regulates the all endocrine glands. One thing. Then the next important part is the pituitary gland. Pituitary gland, as I told you, that is located in the part of fossa of the sphenoid bone. You have seen the wings of the, so sphenoid bone is also having the wings, that we will talk later on. At present, that base of the sphenoid bone is having the floor or the roof. Lying in that roof is present the pituitary gland. Pituitary gland is very small. It is about 0.5 gram. But you know that common जितना छोटा होता है उतना शैतान होता है. So pituitary gland, which is 0.5 gram, but slightly affecting of this gland can affect the many another glands. So very important gland, pituitary gland, which is about 0.5 gram and lying in the fossa of sphenoid bone, and that fossa is named as sella turcica. That is called sella turcica. All right. Now see the pituitary gland. The pituitary gland, you can see the another diagram. Look here. This is the suprarenal gland or adrenal gland lying above the kidney. Pituitary gland. See the diagram. It is dividing into two portions. Anterior lobe, which is larger. Posterior lobe is narrow. All right. See, this is the pineal gland, which is again present in the part of brain, and these are the testes, and this is the part of ovary. And look here, the pancreas, thyroid gland, and thymus. Thymus is also important during the fetal life and a part of the childhood, but in adolescence it is regress. All right. Now see the pituitary gland. Look this diagram. As I told you previously, the pituitary gland is consisting of two parts. The anterior part, which is larger in size, that is called adenohypophysis, and the posterior part, which is comparatively narrow, that is called neurohypophysis. Why we given the different name? The reason is developmentally both the parts of pituitary gland develop differently. The posterior part, which is called neurohypophysis or pars nervosa, that is developed from the brain or part of the uh, part, the brain which is developing from this part that is give rise to the development of the neurohypophysis part or pars nervosa part of pituitary gland. And this pars nervosa part which is connecting with the hypothalamus. Look here, these are the nuclei of the hypothalamus, and the axon of these nuclei are connecting to continue to the pars nervosa. That means throughout the life, the pars nervosa retain its connection with the hypothalamus. Try to understand. The posterior lobe of the pituitary gland or the pars nervosa, no doubt it is developed from the nervous system and it is connecting with the hypothalamus throughout the life. How that axon, you see that neurosecretory cells are present in the hypothalamus, and these cells give rise their axons, and these axon terminals comes into the pars nervosa. Try to understand. I will use again this thing. There is no secretory cells present in the pars nervosa. Try to understand. There is no secretory cells in the pars nervosa, but still it is showing the collection of the hormones, antidiuretic hormone and also the prolactin hormones. So from where these hormones comes? These hormones are secreted from the neurosecretory cells present in the hypothalamus. Understand? So after their secretion, the hormones comes through the axon terminals and collecting here in the pars nervosa. And the part of the pars nervosa which are showing the collection of these hormones. What are those hormones? Antidiuretic hormones and prolactin hormones. These are collecting in the masses in the pars nervosa, right? And besides this, there is nothing, no secretive cells in the neurohypophysis. All right, that is the part which is developed from the hypothalamus. See the another part. The another part of pituitary gland, which is larger, it is developed from the oral cavity, roof of the oral cavity. This is the oral cavity. From the roof of the oral cavity, the part growing upwards, and that is forming the anterior lobe of the pituitary gland. And this anterior lobe of the pituitary gland, which is developed from the oral ectoderm, is named as adenohypophysis. So we have noticed the thing that both the part of pituitary gland also varies from their development. The anterior lobe, which is called adenohypophysis, it is developed from the oral ectoderm, and the neurohypophysis, which is developed from the pars nervosa, that is connecting with the hypothalamus, is called neurohypophysis. And the connection of the neurohypophysis with the hypothalamus, that is this part, that is called stem of the part of pars nervosa, this one. This is called stem of the pars nervosa. All right. Now come to the part of adenohypophysis. The adenohypophysis is having the secretive cells, and these secretive cells are named as chromophores. But when we see the chromophores under the microscope, they don't take any stains, so we are not able to see. The chromophores then progress and forming the chromophils, and these chromophils take the stain. Some chromophils take the acid stain. Try to understand. Some chromophores take the acid stain, and these chromophil cells are named as the alpha cells or acidic chromophils. You can see here diagram. These are called acidophils or the alpha cells. The second type of chromophil cells, they take the basic stain or the violet color. These are named as basophil cells. In short, adenohypophysis is having the two type of chromophils. The chromophores are very lightly stained, but later on they convert into the chromophil cells, and these chromophil cells taking the two type of stain. The chromophils which take the acid stain, that is called alpha cells, and the chromophil cells which take the basic stain, basophil cells. Now this is important because both type of cells secrete the different type of the hormones. See first the chromophil cells, acidophil or alpha cells. The alpha cells secrete the two type of hormones. One is the growth hormone and another is the prolactin hormone. The growth hormone is acting over the long bones before the fusion of epiphysis. Look, this is the epiphysis part. So the growth of the person increase till the epiphysis fuse. After the fusion of the epiphysis, the growth is not there normally. I will talk the later on the part which is further growth after the fusion of epiphysis, that is called acromegaly. That I will tell you later on. Okay. And before the fusion, so this is the growth hormone that is responsible for the growth of the person. Second, the prolactin hormone. This prolactin hormone is acting over the mammary gland and responsible for the milk secretion. Responsible for the milk secretion. Then we come to the part of the basophil cells. The basophil cells, they are secreting the many type of the hormones. The first one, which you are also aware, that is thyroid TSH, thyroid stimulating hormone. Second, parathyroid stimulating hormone, PTH. So thyroid stimulating hormone and parathyroid hormone, which is not shown here, but next to that, adrenocorticotropic hormone, ACTH, that is this one. And similarly, we come to the FSH, follicular stimulating hormone, and LS, luteinizing hormones. So all these hormones, they are coming from the part of basophil cells or beta cells. Now see the first one. What happens? That this hypothalamus, which is sitting here and controlling everyone. How? This hypothalamus secretes the hormones, releasing hormone, and that releasing hormone comes to the pituitary gland. First thing, hypothalamus giving the order. How the order reach? Through the releasing hormone, and that releasing hormones comes to the pituitary gland, and it stimulates the pituitary gland. And that stimulation of pituitary gland reach to the corresponding part of the organ. For example, the releasing hormone is coming to the pituitary gland, and that acting over stimulate the ACTH. After the stimulation of ACTH, then this pituitary gland, it is forming the hormone that is called adrenocorticotropic hormone, and the hormone releasing from the pituitary gland reaching to the thyroid gland, that is the thyroid stimulating hormone. So stimulating hormones are released from the pituitary gland, and their control is from the hypothalamus. How? By the releasing hormone. All right. If the continuation stimulation is there, the hormone will increase in the bloodstream. That is also wrong. So what happens? If the sufficient amount of hormone is in the bloodstream, then hypothalamus releasing the inhibiting hormone, control, and that inhibiting hormone again through the pituitary gland reaching to the target cell and stop the releasing of the hormone. That is the way how this endocrine glands control itself to level in the bloodstream. All right, very simple. So hypothalamus regulates the release of the hormones and also inhibiting the release of the hormones. Most of the endocrine glands which I have discussed, they are releasing their hormones into the bloodstream. The hormones released by the glands, for example, the adrenal glands, pituitary glands, they are passing into the bloodstream. Only the one gland, the thyroid gland, which is not directly releasing the hormone in the bloodstream, it stores the hormone in itself. थायराइड ग्लैंड, देखिए बहुत सीधी बात बता रहा हूँ, ग्लैंड स्टिमुलेट हुई, हार्मोन रिलीज हुआ एंड दैट कम्स इनटू द ब्लड स्ट्रीम. बट इन थायराइड ग्लैंड द मैटर इज डिफरेंट. ऑन स्टिमुलेशन there is secretion of the thyroid hormone, maybe the T3, T4 or calcitonin, that I will come just now. Now what happens? These hormones stored in the thyroid gland. The thyroid gland release the hormone on the need. If the need is not there, it stores the hormones in itself. It is not releasing. It releases the hormones on the time of stimulation or requirement. So thyroid gland differs the other endocrine glands. The other endocrine glands, after their stimulation, they release the hormone into the bloodstream, and thyroid glands store the hormones secreted by it and release that hormones on the requirement. One thing. After seeing this, see the thyroid gland. Thyroid gland is secreting the hormone T3, T4, triiodothyronine and thyroxine, and also the calcitonin. The function of the calcitonin is, are you knowing? Okay, listen. When the blood calcium level is increased, then the calcitonin is acting over the bone matrix to absorb the part is absorbed. That means it decreases the calcium level. Calcitonin hormone is decrease the calcium level. Try to understand, very simple way. Now what happens? If the calcitonin is decreasing the calcium level, that is also wrong. To check this, there is parathyroid gland. So parathyroid gland is secreting the hormone parathormone, and this parathormone is increasing the calcium level, and in this way they regulate the body level of the hormones. Thyroid calcitonin is decreasing the level of calcium, and parathormone is increasing the level of calcium. So ultimately balance is there. Next to this, the T3, T4, all are you knowing, that is responsible for body growth. If the level of the T3, T4 is reduced in the children, the condition is called cretinism. If the thyroxine level, thyroid hormone is decreased in the fetus life or the children, the condition is called cretinism. If the T3, T4 level is decreased in adult, that is called mixed edema. M-Y-X-O-D-E-M-A, mixed edema in adult. If the level of the T3, T4 is increased, that is called thyrotoxicosis. And have you noticed that some patients are having the enlargement of the thyroid gland? That is called goiter. So these are the part of the thyroid gland and parathyroid. Then I come to the part of the adrenal gland. Adrenal gland is having the two parts. You can see the diagram. the peripheral part darker, that is called cortex part, and the inner part is lighter stain, that is called medulla. The two parts of the adrenal gland also secreting the different hormones. From the cortex part, the hormones secreted are glucocorticoids. Glucocorticoids. The glucocorticoids is increasing the glucose level by the digestion of the protein and fats. Glucocorticoids, that is increasing the glucose level. Second type of hormones coming from the cortex part is mineralocorticoids. Mineralocorticoids, and that hormones is control the calcium, the minerals of the body. That is called mineralocorticoids. Besides this, there is the part which is also secreting the some extent of glucocorticoids. The part of sex hormones, very small amount. So these are the parts coming from the cortex part of the adrenal gland. The medullary part of adrenal gland, that is this part, is secreting the hormones epinephrine and norepinephrine. These two hormones, they increase the blood level of the brain and muscles. So, by increasing the blood level of the brain and muscles, the person can stand to fight or press or compare or make himself or herself ready to feel any type of the stress or flight or fight. Epinephrine and norepinephrine, these two hormones which are coming from the medullary part of the suprarenal gland or adrenal gland, they increase the blood level of the brain and the muscles. So person can stand with any type of the stress. So these are the parts of the adrenal gland. Now come to the part of the reproductive organs, that is the ovary and adrenal testes. In case of female, there is the FSH, follicular stimulating hormone, and this follicular stimulating hormone is responsible for the ovulation and also for the properly development of the uterus during the pregnancy. Another is the estrogen. The estrogen is responsible for the ovulation of the ovary and also responsible for the development of secondary sexual characters of the female. I am telling that these two hormones are secreting in the female, progesterone and ovulation, the estrogen. In male, they are responsible for the secretion of the testosterone. So these are the things: follicular stimulating hormone acting over the ovary and responsible for the formation of this ovulation and this, and similarly also acting over the testes, responsible for spermatogenesis, development of the sperms and this. The luteinizing hormone, the another hormone that is also acting over the ovary, responsible for the further development or during the part of pregnancy and this. In case of testes, they are responsible for the further development of the sperms and testes. So these are the different type, all the type of the hormones coming from the adenohypophysis. And which cells of the adenohypophysis? Beta cells. From the beta cells. Besides this, during the pregnancy time, there is the placenta. The placenta is also secreting the hormones, and those hormones are responsible for the further continuation of the pregnancy. The placenta is secreting the many hormones, and these hormones maintain the pregnancy continued. Besides that, then I am coming to the another hormone. See here, the pineal gland. The pineal gland, that is, look here, this is the splenium of the corpus callosum. ये दिख रहा है आपको U shape, that is called splenium of the corpus callosum. At present you just see the diagram, don't stress. Just below the splenium of the corpus callosum, this is the third ventricle. There are the different ventricles in the brain, lateral ventricle, fourth ventricle, third ventricle. I am talking of the third ventricle, that is just below the splenium of the corpus callosum. In the posterior wall of the third ventricle, there is present a small gland, and that small gland is the pineal gland. This pineal gland is secreting the hormone melanocytes, and that hormone is responsible for the circadian rhythm. You will read in detail about the circadian rhythm in physiology. Just try to understand. Your body develops at which time you wake up and what activities you will do. That whole thing continued, and that is called circadian rhythm. And that circadian rhythm is controlled by these hormones of pineal gland. Alright, no problem. Then see, we have divided this pituitary gland into the different parts. Adenohypophysis, we have talked all the hormones. Okay, now see the part of pars nervosa. Pars nervosa itself is not secreting any hormone. Don't speak that the hormones coming from the, no doubt it stores. It stores the hormone, and these hormones are two. One is the prolactin and another is the growth hormone. Besides these two, look here, that is the part stalk. That stalk is continued with the hypothalamus throughout the life. And surrounding the stalk, there is pars intermedia part, that is this one which is separating the adenohypophysis from the pars nervosa. This is called pars intermedia. And third one, surrounding the stalk, there is another part of the pituitary gland. You are seeing this is the stalk, middle one, where you can see the axon terminals, and surrounding the axon terminals there is another different part. That part is called pars tubralis. That is called pars tubralis. So these are the different part of the pituitary gland. Now see, the pars intermedia part, we believe, I am using the word believe, not confirm, still not confirmed, the melanocytes hormone are coming from the pars intermedia, and this melanocytes hormone is responsible for the pigmentation of the body. That is coming from the pars intermedia. And the pars tubralis part, that is secreting the few amount of the sex hormones. So these are all about the endocrine glands. Now let's see what are the problem. All are you knowing about the Amitabh height? That is not normal. So what happened? When there is the excessive secretion of the growth hormone. Listen, when there is excessive secretion of the growth hormone before the fusion of epiphysis, that condition is called gigantism. I am repeating again. Excessive or the very height above the normal height. If the person is having the very long height than the normal height or excessive height, this is resulting due to excessive secretion of the growth hormone. Excessive secretion of the growth hormone before the fusion of epiphysis. Right? That will resulting into gigantism. Very top. Just reverse to this. No doubt, epiphysis is fused. Normally, the height is not increased. But If the person after the fusion of epiphyses still the growth hormone are increasing, that will result into the not in gigantism, but the person can have the higher head, neck and trunk. That is called acromegaly. That is called acromegaly. The hand will enlarge, the feet can enlarge, the neck portion can be very large. So you have seen that slightly difference in the normal picture of the hormone that will distort the person. Okay. Now come to the part of thyroid gland which I have already told you. Cretinism, mixed edema, goiter, thyrotoxicosis and all that. That is related with the thyroid gland. Now come to the part of adrenal gland. If the ACTH is secreting more, that will resulting into the formation of excessive deposition of fat, excessive deposition of the fat, and that excessive deposition of the fat may be over the face or the trunk of the person, right? And we come to the another part, the prolactin hormone, and that I have told you that is acting over this part. Then there is a condition in which the body itself is developed a situation that it destroys the own body cells. What is that condition? Myasthenia gravis. That means the body itself is acting against its own cell, autoimmune disease. So all these are coming under the head of endocrine glands. So we have just go through the general idea, not in detail. Detail we will come by one, where in gross anatomy you will read that each gland, thyroid glands, adrenal glands, pancreas and all this. Yes, pancreas is left. Look, the pancreas, the another endocrine glands. The pancreas is called the mixed gland. Pancreas is called the mixed gland. मैडम सुन लीजिए, काम आएगा, बात बाद में कर लेना. I am telling you. Don't turn your faces here and there. Be serious in the class. Pancreas is called the mixed gland. Why it is called mixed gland? Because it is having both parts, endocrine part and endocrine part. Today we are talking about the endocrine part. So, the pancreas endocrine part is consisting of two types of cells, alpha cells and beta cells. One alpha cells that is secreting the hormone glucagon, which is increasing the level of glucose, and beta cells are secreting the hormone insulin, that is controlling the blood glucose level. Everyone knows their effect, diabetes and this, so I need not to repeat this. Okay. Any problem you feel during the DH? I am asking you frankly. Don't think that, and if you are not feeling any problem, then listen. Revise all the bones which you are teach you, because we will not repeat these bones again. First point of the bone, I have told you many times to each table. You must identify the bone. Second, hold the bone in anatomical position. If you reply this true, then the teacher will ask you what are the muscle attachment on this bone. So, when you will read all the muscle attachment since beginning, then you can retain it afterwards. Because during the exam, it is difficult to retain all the parts. Each bone is having multiple muscles attachment, right? So treat this like this. And from the 1st October onwards, we will start the gross anatomy. In gross anatomy, first we will talk starting from the upper limb. So after knowing the bones, when we will talk the different muscles, it will click in your mind that attachment of the muscle is on this part and its action, what are the action and all that. Okay. And lastly, I am telling you, because today one student complained me someone has broken her locker. I don't expect that any one of you will do this thing, because everyone belongs to good family and no one will do such type of nuisance. Am I wrong? I feel that I am wrong, because none are speaking that no sir. Should I teach you each and everything? So put the locks on your locker. Okay? So you will not face such type of problem. And purchase the books according to the list. The book which I have put on the first number, that is first, then second. I don't think that I have put any Birichorsi on the list. How many of you have seen the list of the books? There is mentioned the Birichorsia, fourth number. And if still you purchase the fourth number books, you can judge yourself. Where are you? Understand? So I need not to repeat this thing again.